Welcome, everyone. Hello, everyone. Welcome to our webinar. Welcome, everyone. Thank you for joining us. Welcome. Hello again. Welcome to the Diabetes, Special and Vulnerable Populations and National Learning Series. We will get started in 1 to 2 minutes, allowing people time to join us. Thank you, everyone, for joining. You can introduce yourselves in the chat and where you're coming from. You're joining us from today. We would love to know that. All right, let's get started. My name is Abba Anderson. Welcome to our webinar today, Environmental Impacts on Diabetes Access to Care. We are excited to have you all join us today. Please introduce yourself and where you're joining us from. If you have any questions for our panelists, kindly drop them in the chats. We are excited to have you all here today. A quick reminder, diabetes affects 37 million people in the United States and this is the third year the Special and Vulnerable Population Diabetes Task Force has engaged health centers and other health organizations by hosting the National Learning Series. This series is funded by HRSA and the Bureau of Primary Healthcare as part of the Health Center program. It is in response to the 1 to 7 health centers patients that have been diagnosed with diabetes and the 1 to 2 that are challenged to control it. We are taking a multi-tier approach to address, prevent, treat, and create management strategies for diabetes care. And we welcome you to visit our website at chcdiabetes.org to learn more about our work. There are 14 national training and technical assistance partners organizations that make up the Diabetes Task Force. These are the logos that you can find out about us on the website. Today is the last day of the 4 series that the Diabetes Task Force put together. If you missed the previous ones, you can find the recording later next week on the website at chcdiabetes.org. This webinar is eligible for CEU units, and the faculty today have no real or perceived conflict of interest. We have no commercial relationships with any pharmaceutical or biomedical companies. Migrant Clinician Network is accredited as an approved provider for continuing nursing education by the American Nurses Credentialing Centers Commission on Accreditation. To receive continuing education credits for this activity, the participant must complete a post-activity evaluation. Once successful completion has been verified, each participant will receive an electronic copy of his or her certificate. The planning committee members, presenters, faculty, authors, and content reviewers of this CNE activity have disclosed no relevant professional, personal, or financial relationship related to the planning or implementation of this CE activity. This CEN activity received no sponsorship or commercial support. This CNE activity does not endorse any products. And the link will be put in the chat for everyone now and at the beginning as well. I am excited to introduce our faculty today. First is the Director of Policy and Program for Farm Worker Justice, Alexis Guild. I am also happy to welcome Maria Bustamante. She is the Diabetes Program Manager for the National Center for Farm Worker Health, and myself, Abba Emerson, I'm a Project Manager for Health Outreach Partners, as your moderator for today. And with that, I would like to invite Alexis Gill to keep all of today's webinar, to kick off all of today's webinar with the learning objectives and an overview of environmental justice and the intersectionals of access to care. Alexis.
Thank you, Abba, and thank you so much to all of you for joining us today. So today, in the last webinar of the series, we will be talking specifically about the environmental impacts on diabetes access to care. If you can go back one slide, yes, thank you. The learning objectives of this webinar are threefold. One, to summarize the role of environmental justice issues on diabetes management and access to care for special and vulnerable populations. Two, to identify the role of health centers in addressing environmental justice issues and impacts on diabetes management and access to care. And three, to describe tools and strategies to support health center staff in addressing environmental impacts on health and the well-being of their staff and patients. Next slide, please. So before I hand it off to our main speaker, I just wanted to provide a quick overview of environmental justice and how it intersects with access to care. So, we all have heard the term environmental justice. Generally, environmental justice refers to the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. But of course, when many of us think about environmental justice, we actually think of what is defined as environmental injustice, which is generally the inequitable and disproportionate impact that these environmental impacts have on poor, minority, and disenfranchised populations. Next slide, please. So how does it intersect with access to care? So many of the populations we serve are disproportionately impacted by the environmental stressors that are caused by climate change and other hazards that we face in our current environment and climate. The interplay between environmental stressors and social determinants of health has been seen in a lot of different ways. One example is in the higher frequency of extreme weather events and heat, and thinking about farm workers, a population that we serve. heat stress is something that farm workers are susceptible to more so than other populations because of their working and living conditions of which they have very little control. So farm workers are outside and they have little protection. They are not able to access breaks or water adequately enough to protect themselves. And that is just one example of how these environmental stressors caused by climate change can impact populations and are part of the social determinants of health that we discuss in public health. And of course, you know, the intersection between environmental justice and community health extends beyond the individual stressors to overall community, including food security as an example, due to drought, due to heat, due to extreme weather events, there becomes an increased lack of access to food and other parts of the environment that help support our food security. So that's just a very quick overview. And our guest speaker will be going into a lot more depth on these issues. If you can go to the next slide, please. Our guest speaker is Jessica Hinshaw, who is the Program Manager of Environmental Health in the Public Health Priorities Division at the National Association of Community Health Centers, or NAC. I'm sure many of you have worked very closely with NAC over the years. In her role, she learns from and works alongside community health centers engaging in environmental health work. She also oversees initiatives in solar power, food security, and extreme heat. Before coming to NAC, she held various positions with AMOS, Health and Hope, in Managua, Nicaragua, as well as the New Mexico Department of Health and the University for Peace in San Jose, Costa Rica. Her work is focused on community-based participatory research in public health, environmental health, and the impacts of climate change. And in addition to her work at NAC, she's also currently a doctoral student at George Washington University. So I'm going to hand it over to Jessica. Thank you so much for joining us, and we can't wait to hear what you have to share.
Thank you so much, Alexis, for introducing me, and thank you so much to all of the organizers for inviting me to join you on this very important topic and session today. It's truly an honor to be here with you all. Next slide, please. And maybe one more. Thank you. So today I will be talking more broadly about environmental health and climate change and how this impacts human health. And then I know later on in the Learning Collaborative, you will talk more directly about the intersections of diabetes and climate change and environmental injustices. But to get going, I wanted to kind of set the stage, and Alexis already did a great job of doing this, but really describing what is environmental health. So the World Health Organization says that clean air, stable climate, adequate water, sanitation and hygiene, safe use of chemicals, protection from radiation, healthy and safe workplaces, sound agricultural practices, health supportive cities and built environments, and a preserved nature are all prerequisites for good health. So this is, really broad. And like Alexis was saying, it really overlaps in many ways with the social drivers of health. And I just want to reiterate something that Alexis said, that unfortunately, when we talk about environmental health and injustices, some communities are more impacted than others. And this typically, unfortunately, are communities of color who have been impacted by historical and racist redlining policies, those who have limited or low income, and those who work outside, and some people who have chronic diseases. Next slide, please. So health centers have a great history of being involved in addressing climate change and environmental health issues. And I'll go over a couple of case studies later. But one thing I really like to point out is that addressing environmental health issues is truly in health centers' lane. In fact, it is embedded within our Section 330 statute, which authorizes health centers to provide environmental health services, including the detection and alleviation of unhealthful conditions associated with water supply, chemical and pesticide exposures, air quality, and also lead exposure. Next slide, please. So if you remember back to that really broad definition I presented from the World Health Organization, it mentions having a stable climate as being a key component of environmental health. And so this graphic really just displays the myriad of ways that climate change impacts human health. So as we are seeing, increases in greenhouse gases in our atmosphere, causing an overall rise in atmospheric temperatures, we're seeing more extreme heat waves, which cause heat-related illness and death and cardiovascular failure. We're seeing more ground level ozone pollution, which results in asthma and cardiovascular diseases. We're seeing a rise in vector-borne illnesses from mosquitoes and ticks. And we're also seeing forced migration as some people have to leave their ancestral homelands in search of areas that have a more stable climate. And one other important factor that I want to bring up quickly, next slide, please, is the billion-dollar weather disasters that we have been experiencing here in the United States. So in 2021 alone, there were over 20 different billion climate or weather disaster events in the United States. And this map kind of displays what those events look like. So out west, we have fires and drought and sometimes flooding. In the Midwest, we're seeing increases in thunderstorms, severe thunderstorms. In the South and the Southeast, we're seeing more hurricanes, we're seeing tornadoes, and that severe winter storm that occurred in Texas in 2021. So unfortunately, these billion-dollar horrific climate and weather disaster events are only expected to increase as our climate continues to overall warm. And so this has severe impacts for community health centers and the services that they provide. Looking at two different angles. One, these climate and weather disaster events directly impact patients. It may cause, injury or harm to patients, and it also has mental health impacts. And then secondly, these weather events can cause huge issues in community health centers' infrastructure. So it may knock out power for a few days, which can lead to community health centers losing their supply of medications that need to be refrigerated. And then it also impacts, the days that community health centers can see patients if they don't have any lights on or any electricity at their centers. Next slide, please. So, I just presented a couple of slides that painted a really grim picture for us, but I do want to say that there are a few kind of beacons of hope, and there's a real role for community health centers and healthcare providers to play. So the first one is, and these results are coming from a national survey, that health is actually the #1 motivating factor for climate action. So protecting personal and public health was ranked among participants in the survey as being even a bigger motivation than increasing good paying jobs in the United States or than strengthening resilience in our communities. Next slide, please. And then primary care physicians and actually nurses are some of the most trusted sources from whom to receive information about climate change and environmental health. And this is really key, especially as patients are coming in maybe with asthma, with other conditions that are being impacted by climate change and environmental health issues. Next slide, please. And now I'm just going to get into a few health center examples. And so these are coming from all across the United States. It's not necessarily a representative survey or depiction of health centers, but they're just ones that we want to highlight for you. And just one thing that we're trying to do at NAC is actually capture more stories about what health centers are doing so that we can kind of put together a resource guide. But first I want to highlight La Maestra in San Diego, California. So they have a number of different environmental health and climate change initiatives going on. But the one I want to point out to you today is their asthma remediation program. So they actually have a home visiting program where members from their community, employees from their community health center go out into the homes of low-income individuals in their community and look for asthma triggers in the home and look to remediate those asthma triggers, whether that be providing new pillowcases and bedding, or whether it be working with the residents to write a letter to their landlord to address these issues. Next slide, please. We have Sun River in New York, and they have actually instituted a vice president of sustainability and planning position in their organization. And this is really integral because he is looking at, first off, starting to build sustainability and environmental health literacy within Sun River Health, within the community health center and all of the folks who work there. They are focusing on like a whole ecosystem vitality approach. They are mitigating and adapting to climate change, which also means they're looking at how can they make their infrastructure more resilient and reduce their greenhouse gas emissions. Next slide, please. 16th Street in Milwaukee, Wisconsin. They, since the 90s, have had a Department of Environmental Health that has just done incredible work. They have largely focused on revitalizing and restoring a key river area in their community, and also revitalizing a park so that their community members have access to green space and clean air and a great place to go be outside. They are also doing a home visiting program to prevent lead poisoning and checking lead in community gardens. They also provide interactive environmental education to elementary school students, so to really get the next generation activated and involved in addressing environmental health and climate change issues. Next slide, please. We also have UMA Community Clinic out in Los Angeles. So they have some really, really great programming around kind of sustainable food and healthy food. But the one I want to focus on today is their activation around addressing urban oil drilling in their community. So in Los Angeles, there is actually just a number of urban oil wells located next to schools and older adults' homes and daycare centers. And so they ended up working with other local organizations and joining like a coalition that ended up attending city council meetings and really raising awareness about the health impacts of urban oil drilling. They ended up educating their care teams and staff about the health impacts of urban oil drilling. They contributed to environmental text campaigns, and then they screened their patients for some of the common health issues associated with urban oil drilling, and then acknowledged and connected their patients to resources to address these issues. Next slide, please. And then finally, Crescent Care in New Orleans, Louisiana. So as many folks are well aware, New Orleans, unfortunately, is severely impacted by hurricanes and flooding pretty much every year. And so in the aftermath of Hurricane Ida last year, unfortunately, 19 New Orleans residents died from excessive heat, lack of oxygen, or carbon monoxide poisoning. So Crescent Care in New Orleans has engaged in the Community Lighthouse Initiative, which is creating a community-wide network of nonprofit resilience hubs, which are each powered by commercial scale solar systems and backup battery capacity, which would allow, the idea is to make sure that everyone in New Orleans is within walking distance of one of these hubs so that they can access heating and cooling when there's a power outage or when one of these weather events strikes New Orleans. Next slide, please. And so while I've presented kind of a broad overview and broad case studies of how health centers are engaging in these issues, I did want to point you to a couple of resources that might be of interest. So first off, we have Eco America's Climate for Health Ambassadors Training Program, and I'll link these resources in the chat for you all. But this is a 4-hour training program that goes into more detail about how climate change and environmental health or environment impact human health and what some resources for action are. And this is specifically tailored to health professionals. NAC is actually working with Eco America to tailor these resources specifically for community health centers, and we're expecting that to be available sometime next year, early next year. But their training that's available now is incredible, and this is completely free. Another recent training resource that's come out is the AmeriCares and Harvard Sea Change patient-centered climate change toolkits. So this goes over a number of different climate or weather events, and then looks at the intersections of providers, patients, and administrators and chronic diseases. So, you know, if you are a provider for a person with diabetes and you're experiencing a heat wave, what should you do as a provider? And then there's resources for the patient themselves. And then there is also resources for administrators. And so I'll go ahead and link that, but I think those are really helpful resources. Next slide, please. And then finally, I wanted to bring up the Community Health Access to Resilient Green Energy Partnership, or the CHARGE partnership. So this is a partnership between Capital Link, Collective Energy, and NAC. And what we're trying to do is help health centers take advantage of the Inflation Reduction Act stipulations, which can provide up to 60% tax rebates for community health centers that are located in certain areas. So basically, this partnership is designed to be a turnkey approach where we can help you to design, install, and finance cleaner energy solutions. And that's really associated with solar panels and backup battery systems. So please feel free to get in touch, and we're happy to talk to you more about this partnership. Next slide, please. And then finally, you know, just wanted to throw my email up here. We have an environmental health and climate change interest group at NAC. If you're interested in joining, we do send out, you know, monthly newsletters and try to host calls, and we're really receptive to supporting you in any you know, issues you want to address. For instance, last month, a letter was released by the EPA regarding some issues going on in the industrial corridor of Louisiana. And so we were able to get other stakeholders from the EPA and from other community health centers on a call together to try to address the issues impacting their communities. So we're just really here to support you and your work, and would love for you to reach out. So with that, I think I am, you know, finished with my slides, but I want to turn it over to Maria Bustamante. Thank you.
Thank you, Jess, for that great presentation. And I do want to open it up. And if any of you have any questions from what you heard, or something that you're thinking that would like to share, please feel free to add it to the chat or the Q&A. Send us a question in there, and I think we're going to have some time at the end to do a short Q&A and get some of your questions answered in a little bit more depth. So yeah, feel free to do that. And my name is Maria Bustamante. I'm the Diabetes Program Manager for NCFH, the National Center for Farm Workers Health. And I'm really excited to be here with all of you following Jessica's presentation and Alexis. So thank you. I'm going to be covering a little bit. You already heard from Alexis what environmental justice is, and an overview of it, and just also shared an overview of how the intersection between climate change and healthcare and health centers, and share those great experiences and examples from health centers who are already addressing this topic. And I just wanted to go a little bit into what the intersection of the environment is with diabetes care and management. So we're gonna cover the direct and indirect effects on diabetes from climate change, that they are interconnected, and you're going to be able to see that everything is kind of mingled, everything is interconnected. And there's some direct connections that refer to how diabetes and climate change adversely impact each other. And there's other indirect connections. Those refer to the common global vectors and pathways that are fueling both health and development disasters. Both indirect and direct combined, they should form the base for an aligned policy agenda from health centers to combat these problems. So what do we have as direct connections? And we have increased evidence that shows that diabetes and climate change are directly linked. These links include, as you see in the slide, adverse health outcomes and increased diabetes risk, food insecurity, and malnutrition, and diabetes, obesity, and greenhouse gas emissions, which the last two kind of feel like two ends, right? Two different things, opposite on the opposite sides, but they're both directly connected. And this on the indirect part, indirect aspects, we can see the rapid urbanization. We can see how cities are changing, and that is creating changes in lifestyle for diabetes patients and so many other changes. Rapid population demographics is changing, right? And globalized food systems, which are strained from the different climate change aspects, different severe weather conditions, changing weather conditions, water levels, so many different things have put a strain on our food system and our agriculture. And at the same time, we have the issue of an increased population. So everything is commingled, and people with underlying medical conditions such as diabetes are more vulnerable to the adverse health impacts of climate change. And if you go to the next slide, we see three different aspects that create an adverse health impact on that people with diabetes. In hotter temperatures, you have dehydration, heat strokes that increase morbidity, and mortality in people with diabetes increases also. People with diabetes are predisposed to cardiovascular events during heat waves. We all who work with diabetes patients know that there are correlation between diabetes and cardiovascular diseases, and how commingled they are and how related, and the increased risk of complications between them. So this increases that complication. People with diabetes are predisposed to cardiovascular diseases during this change in temperatures and heat waves. And there's also a higher mortality from a heart attack on days of high air pollution, or also of high heat. This climate change increases the occurrence of climatic events, and these climatic events also have an effect on water. And by water, we mean not only the water that we have accessible to drink, right? But also the quality of the water that is available during natural disasters, during floods, during drought. there's during a flood, there's accumulations of water and different diseases that arise from it. And people with diabetes have a higher tendency to be more susceptible to those diseases. The same with the drought, the lack of water or no access to water creates issues as well in the food system in so many different ways. So water, we have it in not only as that drinking water, that it can be contaminated, it can be polluted and have different levels of toxins in it that are not good for our body, but also that can enhance other issues with diabetic patients. So with natural disasters, we have an increase, as I just said, of extreme climatic events going on every year. Amongst those, we have hurricanes, we have floods, we have fires, tsunamis, earthquakes, droughts, which often displace people, right? And they create inadequate living conditions. They increase the growth of slums or increase resource scarcity. All this environments where the diabetic patient epidemics thrives in this environments and kind of enhance also all the different complications that they may have. So next slide, please. As we look at what a specific example of how you may think, well, heat stresses the body, right? But you have people with diabetes who may not be able to regulate their body temperature, and that creates that thermal regularity dysfunction that they cannot, in a heat event, they cannot cool off the same way that a person without diabetes can. In a extreme cold weather event, they cannot heat up their body the same way. So either both the heat or the cold, they both affect people with diabetes on that condition. And the same with the glycemic control. In glycemic control, it can be a direct effect of a heat exposure or a cold weather event, and be having patients or people with diabetes who are able to self-manage and who are educated on what to do in these cases, and given the proper education through health education, and to be able to know what to do in this events is crucial for them. The same with the increased cardiovascular signs in people with diabetes. As I said before, diabetes and cardiovascular disease, there's a direct correlation, and it's a complication that always has to be taken into consideration, and it's exacerbated by this environment changing climate conditions, and that's all of it increases the higher mobility, that seems wrong, but higher risk of mortality. So that's what we have to, as health centers, work for and strive to avoid, and take into consideration what's going on in your area. What type of extreme conditions are you facing on a regular basis, or becoming more common, or or you feel that your winters are getting much stronger, or your summers are getting super hot, more than usual. So be attentive of those and know this connection so that you can help your patients with diabetes address them. So with that, I think I hope I've given you a quick overview of what the environment and diabetes, how they're interlinked and connected. And we didn't touch on any indirect ones and all the others. So if you want to learn a little bit more on this topic and get a little bit more resources on this and have an opportunity to share with other health centers and guest speakers and content experts on this topic as well. I invite you to join our learning collaborative that's gonna start in March 2023. The date is still pending, but stay tuned for that kickoff, and you can register as soon in our website. And Kara shared the website in the chat as well. Next slide. And if you want to read a little bit more in the meanwhile on what's out there, what has been written on this topic, and how can you learn a little bit more, go to these resources. These are specific resources for health centers that we have put together from different partners that are content experts in the topic. And next slide, please. We also have some climate change resources that we hope you find useful. And all this information is going to be shared and used for the learning collaborative. So if you're interested, as I said, make sure you register for the learning collaborative and stay with us for that. So we wanna just share with you the evaluation and continued education units. I know there were some questions at the beginning. Please make sure that you fill out this evaluation link, and it's also been shared in the chat. So you can just click in. Your evaluation is gonna give you the CEU certificate that you need for your continued education, as well as it's going to give us a little bit more information on what you want and how we did today. So please make sure you fill it out. And I wanted to give since we have a little bit of time, and while we have that on the screen so that you can share with us your evaluation while you're doing that. I wanted to invite Jessica and Alexis to see if there's any questions from anyone in the audience that wants to send us a question, or if Alexis and Jess has any. So feel free to share.
I'll just add that the Learning Collaborative will go much deeper into these various topics, and specifically, that intersection that Maria really talked about between these environmental issues, these climate change issues that we're seeing year after year become more prominent in the communities that we serve, and how it links to chronic conditions, specifically diabetes, because as Maria shared, there are a lot of direct and indirect impacts. So we certainly encourage you to join us. And if you have any topics, we have topics in mind, specifically around heat and water, but if there are other topics that you would like us to address, please feel free to share that either in your evaluation or through contacting myself or any of us on this webinar, specifically myself and Kara, and then we can incorporate that into the Learning Collaborative.
I agree. And I saw a comment coming in the chat and about educational materials that we can share with, that you guys can share with patients on how environment can change someone can affect someone with diabetes. And I think that we if you go to the resources, one slide back, no, 2 slides back, sorry. We have in there a couple of the links, and I don't think I see where you can find a little bit on a specific, you can look at emergency preparedness plans, specifically also for people with diabetes, and those emergency preparedness plans address some of that, at least the natural disaster part, right? That is, I think, one of the, I would call it, I don't know if you guys would agree, Jessica and Alexis, a little bit of the low-hanging fruit of this topic, which is, you have all these natural disasters that are occurring. So let's at least prepare our patients to be able to handle those appropriately, and don't interrupt their access, their care and management, and give them enough tools so that they can themselves self-manage in the meantime, or be able to brainstorm their own solutions, or have enough information so that they can make informed decisions.
Yeah, and Maria, thank you so much. I think this resource guide that you've put together is really just phenomenal, and I'm really excited that participants will have access to this. In that AmeriCare's, specifically their climate change resilience toolkit, there is a patient guide for diabetes. And so I specifically linked that guide in the chat. And that was the heat one, but I think they have one for a couple of other environmental disaster, climate change, weather events. But that is, I think, a pretty great resource. Unfortunately, it is only available in English right now. I think there might be intent to get that translated in the future. I'm not quite sure about that. But also, if you do end up using any of those guides, I know that Harvard and AmeriCares are really open to any feedback. So, if you do end up using them and have any feedback, please let any of us know, and we can connect it back to AmeriCares, because they do want to spend more time evaluating these resources as they're used in the field.
That's great. Yes, I do agree. I think that sometimes, we shy away from giving feedback, and it's so valuable, your feedback, that you're in the field working with the people with diabetes, persons with diabetes, and it's so important to have your voice so that we can translate that and give you the tools and materials that you need as well. So, and support. So we appreciate your feedback always, and we appreciate your time today with us, and we want to thank you on behalf of everyone here today on participating. I don't think we have another question. Do you have any additional comments, Jessica and Alexis?
I would just say, and I don't want to speak on behalf of everybody, but please correct me if I'm wrong if you don't feel this way, but if you have any, initiatives that you are doing related to the intersection of diabetes and climate change, or any other chronic diseases and climate change or environmental health, please let us know, because we would love to learn from you, and we would love to help, share any of the lessons that you've learned with others, because that's really the best way to learn, is really co-sharing anything that you've learned along the way. So thank you for joining us, and please reach out. We'd love to hear your stories.
And I'll just add that there are some comments about how this webinar has allowed you to kind of think more about the interconnectedness between diabetes, chronic conditions more generally, and climate change. And so that's really fantastic. And we encourage you to continue this conversation because climate change is going to continue to have a greater impact on the populations we serve. We have all seen all the various weather events Jessica pointed out over the past couple of years, and that will continue. So we really appreciate you joining us. And, we certainly hope that this is just the beginning of a conversation. So thank you very much.
Definitely. I think it's totally a beginning of the conversation, and we look forward to continuing and digging a little bit more into the topic, and we hope you can join us.
There is a question in the chat for you guys. If there's any information on hypertension, if somebody can address it quickly before we step out.
I saw that Kira linked to the diabetes and hypertension resource from AmeriCares, and that's what came to top of mind too. So thank you, Kira. I'm not sure, Maria, if you have something else.
Yes, definitely. That's a great resource to go to. And I think that as diabetes educators or people who work with people with diabetes, we always have to think of ourselves nowadays, not only as diabetes educators, as diabetes, but also as cardiovascular and heart disease. They're so commingled. As I said, I cannot emphasize that enough. And looking at it as a whole is going to help your patient and your population. And we appreciate everything that you do for them. So thank you. And I think we don't have anything else. We thank you for joining us today and look forward to seeing you soon.